Hello everyone, future nurses. In today's discussion, we're going to tackle the interpersonal theory. Let me now introduce to you Harry Stack-Sullivan. Who is Harry Stack-Sullivan? He's the author of the interpersonal theory and he was considered the father of interpersonal psychiatry. So here are some of the personal details of Harry Stack-Sullivan. He was born on February 21, 1892 in Norwich, New York, and his parents are poor Irish Catholics. So he was the son of a poor man and a farmer. During his childhood, he does not have friends and he has a poor relationship with his father. So he grew up isolated and a loner. And then what is notable with Harry is that he is academically gifted. In fact, he graduated from high school as valedictorian at the age of 16. And then he entered Cornell University intending to become a physicist, although he also had an interest in psychiatry. However, during his stay in the university, he had an academic performance issues and he had troublesome stay in the university and he was suspended after a year and he was possibly suffering at the time of a schizophrenic breakdown. And then eventually, Dr. Sullivan graduated from Chicago College of Medicine and Surgery despite his academic struggle. So at the age of 25, he obtained his Doctor of Medicine and Dr. Sullivan worked as a psychiatrist at mental hospital in Maryland, although he do not have any formal training in psychiatry, but devoted his years, particularly in clinical and research work, to help people with psychotic illness, especially patients with schizophrenia. So he was identified as a clinical wizard in the treatment of schizophrenia and he was never married. So those are just some of the personal information about Harry Stack-Sullivan. To give you an overview of the interpersonal theory, here are some information. Interpersonal theory focuses on relationship between people and also on the social context. And it is viewed that personality can never be isolated from the complexity of interpersonal relation in which the person lives. So it is stated that without people, human would not be able to develop personality. So what is personality? According to Sullivan, personality is a behavior that can be observed within interpersonal relationship. So, according to him, interpersonal relationship and social experiences are actually crucial in shaping one's personality. It is also believed that our uh, patterns of communicating or dealing with other people may also influence the development of a disease, a mental disorders, and Sullivan believed that one's personality does not only involve our personal characteristic, but rather it is how we interact with other people. And he always thought that personality is a behavior that develops from our constant struggle between needs and anxiety. According to Sullivan, there are three levels of cognition. So he recognized and divided this cognition into three modes. So these are prototoxic mode, pyrotoxic mode, and the syntaxic mode. Prototoxic mode. Prototoxic mode occurs during infancy and childhood, and children at this mode experience brief, unconnected experiences that have no relationship to one another. So it's like during this stage, infants are actually having sensations, they have thoughts, they have feelings. But out of these feelings, out of these experiences, they could not draw any conclusion or they could not make any inferences. So these experiences at this point are impossible to be put into words, and these children could not communicate it to others. Say, for example, a neonate that feels hungry and they may feel pain, and these are the prototoxic experience that result in observable action. And say, for example, they may suck, they may show sucking reflex or crying, but the infant does not know the reason why he has to do this action. And then, after the care provider sees them sucking or probably crying, their primary caregiver will be giving them food, or they will be offered with breast milk. But at this point, the infant does not know the reason for that action and sees no relationship between the action that they present and being fed. So this is happening in the prototoxic mode. So in adults, particularly those clients with schizophrenia, they exhibit persistent prototoxic experience. The pyrotoxic mode. The pyrotoxic mode begins in early childhood as the child begins to connect experience in sequence. At this point, the child sees events as casually related because of chronological or serial connection in the absence of logical relationship. The child may not make a logical sense of their experience. Instead, they may see things happening as a coincidence or this event happens by chance. Example of paradoxic thinking is taking place when a child is conditioned to say please in order to receive a candy. Now, every time she's going to say please, he or she receives a candy. If candy and please occur together at a number of times, then the child may eventually reach the illogical conclusion that her appeals caused the candy to appear. Now, this conclusion is a pyrotoxic distortion. This pyrotoxic distortion is an illogical belief that is based on a cause and effect relationship between two events in sequence. However, saying the words please does not by itself cause the candy to appear. We know that very well. And in order for the candy to appear, there should be specific person, particularly a dispensing person, who is willing to honor the request. And only then the candy will appear. So it is also noted that paranoid ideas and slip of the tongue is when a person is operating in the pyrotoxic mode. So pyrotoxic distortion at this point serves as an immature cognitive defense mechanism against the psychological stress, and they said that it is similar to transference. The syntaxic mode. The syntaxic mode begins to appear in school-age children and becomes more predominant in pre-adolescents. At this point, this child has now a clear understanding of himself and the world where he lives in and can now analyze experience in different situations. At this point, he now believes that everything's happened because of a certain reason. They now understand and they are now oriented to reality. And they can explain now that there is logic in every experiences. Syntactic mode is actually the highest stage in experiencing the world, and this is characterized by consensual validation. And this is consensual validation wherein language has its meaning, and its meaning are derived from group activities, interpersonal activities, and social experiences. At this time, the child knows how to communicate their ideas and to share their experience in a commonly accepted language. So there is now maturity, and maturity is predominant in syntactic mode. The interpersonal theory of Sullivan involves three major concepts. These are the anxiety, the self-system, and the security operation. So first is anxiety. So anxiety is an essential theme of Sullivan's theory, and it arises out of one's inability to satisfy needs or to achieve interpersonal security. He also believed that these are the disrupting force in the development of serious difficulties in life. And they identified that anxiety is usually identified as the barrier that keep us from fulfilling our needs. So these are any painful experience or emotion that arises from social insecurity or anything that prevents us achieving or gratifying our biological needs. To continue with the major concepts, the self-system. The self-system is the significant aspect of the personality that develops in response to anxiety. So Sullivan identified three components of the self-system, which are based on interpersonal experiences early in life. These are the three components: the good me, the bad me, and the not me. Let us now discuss the components of self-system. Let us discuss first the good me self. The good me self results from experiences with rewards and approval. So this is a part of the personality that develops in response to positive feedback from the primary caregiver. So we have to consider that during infancy, the primary caregiver is the mother or the one that is actually doing the mothering role. So let us say, for example, when the baby cries, the mother feed her and then her oral needs are satisfied. So once these oral needs are satisfied, there is a feeling of pleasure and gratifications are experienced. So this results to the good me personality. Now, the bad me self. The bad me selves grow from experience of punishment and approval. So the bad me is the part of the personality that develops in response to negative feedback from the primary caregiver. And these are experiences that are related to increase anxiety. Okay, so any feeling of discomfort, any feeling of distress that are experienced are considered to be part of the bad me self. So let us consider again the baby. The baby cries, and maybe the baby cries because he or she is hungry or he has a full nappy, but he was neglected by the primary caregiver. So at this point, he or she receives punishment for being neglected, and maybe crying shows disapproval, so that's why he was neglected, and this situation may let her feel the bad me personality. Now what about the not me? The not me self allows a person to dissociate or selectively not to attend to the experience related to anxiety. So the not me self is part of the personality that develops in response to situation that produces intense anxiety in the child. So at this point, the child may feel a feeling of horrors and dread, and they may experience a lot of or an increased anxiety, and the child may develop emotional withdrawal at this point. So it reflects actually the part of our personality that we are not aware of. And that is the not me self. We are not aware, as in fact, we can see this when we perform the Johari's window. There is a portion there, or there is a portion in the Johari's window that we do not know that that is us because we are not aware of it. And that represents the not me personality. While the good me is what is known to you and what you want others to know you. So that is the good me. While the bad me is the hidden part of your personality. And that is the three components of the self-system. Next to that is security operation. Security operation becomes a part of the system to help the individual to avoid or minimize anxiety. This is actually similar to Freud's defense mechanism. The security operation includes sublimation, selective inattention, and dissociation. So what are these three security operations? So this security operation helps the individual avoid or minimize anxiety. So to give you a clear understanding of these three operations, sublimation is unconscious process of substituting a socially acceptable activity pattern to partially satisfy a need for an activity that would give rise to anxiety. So imagine that you have a fight or an argument with your next door neighbor. And this next door neighbor is just so close to you. So you are still feeling angry, and the feeling of anger might create an urge for you to physically strike out at the neighbor. And because of such action is inappropriate, you consider that this is not healthy. So you might deal with your feelings of frustration by just simply going for a jogging. So this is an example of sublimation. Another way is when we are anxious, we are using selective inattention. So selective inattention is wherein we try to focus on things that matters to us. We try to focus on things that does not cause anxiety. So this is a refusal to see those things that we do not wish to see. So just imagine that you went out on a date with your boyfriend, say for example, okay, at a busy restaurant. And at a busy restaurant, there are so many people, and these people are talking. They are eating, so you can hear the clinking of plates and forks, and there are many other sounds like music. And these sounds, the many sounds, other is actually competing for your attention. Out of all this, okay, out of all this noise, you still to tune out, okay, the irrelevant sound and focus on the amazing story that your boyfriend is sharing. So in this time, we managed to focus on concentrate on the things that we actually would love to hear. We focus on things that will not cause anxiety. So this is an example of selective inattention. So we have this ability to attend things around us. Okay. Then another operation is this dissociation. Dissociation is a way of avoiding or keeping away from anxiety. And this time, there is a disconnection between a person's memories, feelings, behavior, perception, or a sense of self. It's like being detached, being withdrawn from yourself. It's like you separating your mind from your body. So these are all the security operations that are identified by Sullivan. And it is actually the counterpart of defense mechanism by Sigmund Freud. Sullivan established 5 life stages of development. This begins in infancy, the childhood, the juvenile stage, preadolescence, and adolescent stage. Each of these stages is focused on having various interpersonal relationships. The infancy stage. This is the period from birth until the onset of language. And during the infancy period, the infant is known to be very dependent and he needs other in order to survive. The significant person that will help her shape his personality is her mother or the primary caregiver who nurtures and satisfies all his needs from feeding to cleaning his toys. At this point, the child's primary need exists for bodily contact and tenderness, and the infant may receive this tenderness from the mother or from anyone who is taking care of the infant. At this stage, the infant still operates at prototoxic mode where they could not associate experience and they could not put all of these experience into words, and for them it has no definite or concrete meaning yet. At this time, the primary needs or the primary zone that must be satisfied is the oral and the anal area. That's why it's always important to satisfy the oral needs, such as through feeding, through sucking, or through thumb sucking, because with this activity, the infant can actually satisfy his oral needs, and this would relieve anxiety that the infant may be experiencing at this time. And this is accomplished particularly again by activities that is directed to the mouth, such as sucking, biting, crying, and even thumb sucking. If these needs are met, the infant may develop a sense of well-being. However, in the event that these needs are not met, this would lead to anxiety. The childhood stage. This stage lasts from the beginning of language until the need for playmates of equal status. At this stage, the child's primary interpersonal relationship continues to be with the mother. So the mother will still be the source of all experiences, whether negative or positive. And these experiences will play an important role in the development of their personality. We also have to remember that at this stage, the children can now differentiate their mother from other person who is actually also nurturing the child. Parents are also viewed as a source of praise and acceptance that actually helps this child develop his behavior and her personality. So at this stage, there's also a shift to pyrotoxic mode. This time, these children can now explain their experience, can express through words the experience that they have, although they could still not connect the logic behind all these experiences, but rather all of these experiences are just connected because of the order of its events or because of the sequence of the events or of the sequence of each experiences. Now, at this time, the children starts to have an imaginary playmate. They start inventing imaginary friends, invisible friends. And if you would notice, these children are playing on their own and they are playing like a doctor and they are talking to someone. So this is actually an example of an imaginary playmate. They are talking to someone and they are playing with someone that is not actually visible. So this is actually perceived to be normal part of child development. And it is viewed as simply a means to relieve loneliness and anxiety. They also mentioned that if a child has an imaginary playmate, particularly between the ages of 3 and 5, they may present a highly creative and they may become highly imaginative children later on. So this is actually normal part of child development. At this stage, the primary zone is the anal zone. So during this period, the child is trying to satisfy this zone or particularly this erogenous zone through learning how to control or how to delay personal gratification without any undue anxiety. Now, if the child could gratify the anal needs, then this leads to positive self-esteem. However, in the event that the child may not be able to control the anal needs and they could not hold onto these needs, then this may lead to moderate anxiety. And moderate anxiety would mean that this could lead to uncertainty and security. While if this anxiety is a severe anxiety, this may result in self-defeating patterns of behavior. The juvenile stage. The juvenile stage begins with the need for peers of equal status and continues until the child develops a need for an intimate relationship with a chum. So this is usually from ages 5 and 8 years of age. The child at this phase is learning to form satisfactory peer relationship. This is the period when the child begins to go to school. This is the first time that he or she is at school. So his main focus during this stage is the need for playmate and the beginning of healthy socialization. So that's why the important thing that will be developed during this stage is how he will interact with his peers of the same or with the peer of equal status or of the same age. So children at this time, since they are now having playmates, they have now classmates, they have peers who will be dealing with them. So the important thing that they would learn at this stage is they learn to compete. So for them, competition is healthy, and this is later on will be helpful, and this competition will help them to become successful. Children also learn to compromise and cooperate. So they can now listen, they can now anticipate rules, and they actually cooperate at this stage. And of course, part of this period is they negotiate their own needs. And also, they start to associate with other children. And this is the beginning of a healthy socialization. So these three abilities, as well as orientation toward life, help a child develop intimacy. And if the child would not be able to have an intimate relationship with his peers of equal status, severe anxiety may result in, and a need to control or in restrictive prejudicial attitude. The pre-adolescent stage. The pre-adolescent stage begins from 8 years old to 12 years old. And at this point, the child moves to genuine intimacy with a friend of the same sex. And at this time, the child is learning to form a satisfactory relationship with a peer of the same sex. This time, they start to have their best friend, and their best friends play a crucial role in the development of their personality. This relationship between the child and the best friend or the friend, special friend, will make the child feel worthy and likable. And without this ability, later on, the child would not be able to form an intimate relationship. And later on in life, they would have they would not also have the ability to form an intimate relationship in late adolescence and adulthood. And forming an intimate relationship will be quite difficult when they reach the age of late adolescence and adulthood. So at this point, the family is no longer the center of their life. They are no longer the source of satisfaction in relationship. They have now other people, particularly in the persona of their best friend. So this time they now understand, especially if they were able to learn how to compromise during the juvenile stage. They now have a full understanding that there are some people who are actually needing themselves. It's this time they are no longer focused on their personal needs, but rather they now understand that they can help others, especially their best friend. And they can work together, they can collaborate together, And this time, they are just working not to get the reward, but rather they just wanted to extend help to their friend who is in need. So since they have full understanding of other people and they can now understand life experiences, at this time, syntactic mode occurs. The adolescent stage. Adolescent stage begins from puberty and lasts until adulthood or onwards. At this stage, special sharing relationship shifts to the opposite sex. So this stage is actually divided into early adolescence, late adolescence, and adulthood. And the onset of puberty changes the needs for friendship to a need for sexual expression. So they develop their self-worth when they are accepted by their peers, particularly from the opposite sex and at this time, during their late adolescence, the need for friendship and the need for sexual expression get combined during the late adolescence. And at this stage, they want to have a long-term relationship. And then as they move to adulthood, there are so many struggles of adulthood that includes financial security, career, and family. So at this time, success during the previous stages, such as those in adolescent years, adult relationship, and much needed socialization become easier to attain. But if this adult was not able to have a solid background, then an interpersonal conflict may result in anxiety and this would become a problem later on. So at this stage, social experimentation leads to the consolidation of self-esteem or self-ridicule.